also want to take a minute to introduce the other members of our panel. Today, we also have with us Ashley Arnold. She's the Texas delegate for the National Association of School Psychologists. We also have Amanda Fitzgerald. She's the Director of Public Policy for the American School Counselor Association. We have Molly Ticknor, who's the Executive Director of Show Me School-Based Health Alliance of Missouri, and Becky MacGregor, who is the Employee Wellness Coordinator for Albuquerque Public Schools. And again, what we're going to do is we're going to try and continue to extend this discussion and continue to kind of wrestle with issues around how to create support for both, for all members of our community, students and staff during these historic times of uncertainty, and especially to try and bear down. I really appreciated in your presentation, Ken, I think a lot of really specific strategies, targets we can be aiming for as adults in collaboration with children. And one thing we're going to ask the panel to do is also to share some best practices from their point of view in terms of practice, policy, planning, and ways to effectively integrate these lessons into just how schools operate in a really kind of organic way. The first question we were going to start with was, thinking about how to really specifically define what kids are coping with and what might be unique about their perspective. Clearly, I think Ken did an amazing job of that, not only talking about the impacts of COVID, but also things related to social and racial justice, and just, the whole context of really, challenging issues young people are wrestling with. I did want to take a moment to open it up to the rest of the panel and just ask you guys if there's anything else you might like to add or emphasize in addition to what Dr. Ginsburg had to share with us.
I'll go first. I just want to thank you, Dr. Ginsburg, because you just reiterated so many wellness points that I know for myself, I try to get out to our population on resiliency and how do we adapt, especially in these times. So I know we're going to be able to forward this discussion so we can get it to a granular level and give hopefully all the teachers and faculty and staff some of the resources and tools they can take with them immediately for their own health. So thank you.
Thanks, Becky.
Well, and I'll go, Mike. I think to kind of follow up on, we've got to recognize that kids will be returning, really, and recognizing that risk for higher rates of certain stressors or adversities that they've experienced. I know a lot of our domestic violence, our child abuse hotlines have seen an increase in calls. Homelessness, those families that, have experienced some economic difficulties because of this. Mental health problems in the family, and maybe they weren't able to connect with a teleprovider during this situation. Maybe family loss, separation. And then also I think about too, those families that experienced grief, the loss of somebody during this pandemic, but that grief wasn't processed appropriately. They weren't able to attend the funeral. They weren't able to attend the memorial service, And so I think that's some things to think about, that kids are at higher rates of certain stressors as we look to going back to schools.
Thank you, Ashley. I'm particularly, everything you said I think was really important. Especially, connect to the idea of people who have lost people, not been able to grieve. Our experience of this is so not uniform throughout this country. There are places that have been largely spared, and there are places that have been very impacted. And being someone who knows someone who has passed away from this and experiencing that inability to do the things we traditionally do, to do what Ken said, to come together, to grieve together, to share in our emotions together and be strong for each other. It's really an important point. Thank you for sharing that. Anybody else? Great. I guess the next question I'd like to kind of move us into is to ask Amanda if she could describe a little bit some ways that we can embed this type of social and emotional support for students into every part of the school day. So how can we integrate it into classrooms, times on the bus, recess, if there is a bus, but any part of the school day, how we can integrate these kinds of things.
Sure.
Amanda.
Thanks. Thanks, everyone, and thanks for the invitation to speak today with all of you and listen to the wonderful presentation, Dr. Ginsburg. I think that there's a lot of ways that we'll need to focus on our students' well-being entering into the fall. We know that we're looking at different types of entry strategies, whether it's going to be completely virtual or a hybrid or 100% face-to-face. We know that kids and the staff need a physical and psychological sense of safety to learn and to work every day. So I think that'll be really important. So beyond knowing that they're physically safe, even the perception of physical safety, but also knowing that there's this community of people that care for them and are there to help them to get through and start to learn again, or learn in this setting or whatever setting you'll be facing. So one of the ways we can do that I think is really important is relationship building. So I think every person in the school building has a role in that, whether we're virtual or face-to-face. There could be an emphasis on peer relationship building, whether that's like a buddy system or even a mentor type program where there's a caring adult assigned to students, and make sure that every kid has been contacted and that we're regularly checking in with our students to see how they're processing everything and the return to the regular school day. There's lots of evidence-based strategies out there, which I'd certainly recommend you always look for something that's evidence-based. Morning meetings are one way to get at that, to talk about how the kids are doing every single day, to have an opportunity for them to share. Some of those times you can really be able to pinpoint certain words that would lend an adult to make sure that they follow up with that student, and then collaborate with all classroom teachers. Won't be able to do this themselves. All the adults, either virtually or in the building, will have a role in this. Certainly I'd put a plug in there to work with your school social workers, your school nurses, your school counselors, your school psychologists, and hopefully collaborate in terms to make sure that everybody is reached frequently.
Great. Any other panel members have any other thoughts they'd like to share about this idea of just ways we can embed this type of social and emotional support for students into every part of the school day? And I will say this, we also are going to talk about staff as well, but and faculty, other team members. But does anyone else have anything else they'd like to add? Any other thoughts to Amanda's?
The only thing I would add is, when you look into incorporating in it, the key is to have buy-in from the teachers. And so I would definitely say whatever, program or morning meetings or whatever, it's crucial that teachers or the staff that's going to be implementing that is a part of that process, that you have buy-in to ensure that it's implemented with fidelity and it's successful.
Great, thank you. Related to this, and by the way, if you see me looking away, I'm tracking questions. I'm going to try and incorporate them throughout this panel time. But one question I think is important to this kind of concept we're talking about. Someone asked, how do we help our staff and students feel safe? Both are very fearful to return because of concerns related specifically to the virus. If they don't feel safe, they won't be able to help students feel safe. Does anyone have any insights to share, especially specific to the idea of the unsafety people feel related to the virus, both adults and students, because it's connected?
I think it's important to be, this is Molly, by the way. Hi, everyone.
Hi, Molly.
I think it's really important to communicate very effectively and openly about what's happening as of now, as well as daily. Things change so much with this virus and how schools are going to open and what that's going to look like. And so for me, I think feeling emotionally and physically safe is just being communicated to on what those plans are and how, and getting their opinion. I think when you talk about that buy-in, I think it's important to get their ideas. What will help you feel safe coming back? What can we do? And then informing them what you are doing, what you have been, and if there's any gaps. So just continuing to open up that communication for your staff, for your students, for families, for volunteers coming into the building, if that's actually happening. I think the communication is definitely key.
Great. Any other thoughts? Awesome. I'll move on to our next question. Ashley, we'd like to start with you for this one. we know that there are universal things we want to do for all students, which is what we were just describing. You know, this idea that there's certain supports everybody is going to need, everyone is going to benefit from almost equally. But we also know that there are some students who will have additional needs and need additional levels of support. And what I'd like to ask you about, or you to begin sharing with us about, are some best practices related to things like mental health screening, triaging those identified as being in need of additional services, and how we can connect service students and maybe even families to those additional services as they're identified.
Yeah, thanks. Great question. You know, I think the first step is to ensure that you have a multidisciplinary team for planning in this. And typically, you know, people look to just the school-based mental health professionals for this, but you really want to ensure that you have campus administrators, you have teachers, depending on the age, students. You want to make sure you have nurses. You want to make sure you do have your school-based mental health providers on there, but you also want to make sure you have public health officials and community stakeholders as well. And the first thing is to not go in with the idea that one plan's going to fit all. You know, as somebody that's in a large state, Texas, in case you didn't pick up on my accent, you know, we've had communities that are very hard hit and then other communities that haven't been hit as hard. And so I think the first step is recognizing too, don't assume that students in need are going to voluntarily disclose their distress or want to talk immediately. I think that's the first step. So when you think about how to plan for returning after a crisis event, because COVID-19 is a crisis event, you really want to look at first is what was their pre-COVID-19 experience in your school? Was it positive? Was it negative? Was it variable? And then also, then what was their COVID-19 shelter in place experience like? Was that positive? Was that negative? Was that variable? And I think that would give you a nice matrix of recognizing who's at low risk, moderate risk, and high risk for services. And so when you look at, you know, it's just like academic instruction, you're going to have tier 1 that's going to need to do all students, you know, screening, and whether that's, you know, universal screening. I would caution if you want to do a universal screening that you make sure you have the capacity to implement that and implement it with fidelity, and that you're prepared for whatever the results might be. Because you might think only 20% of your students are going to come up at high risk, and your universal screening may show 40 to 60% are at high risk. So you're going to want to have some tier 2 supports in place that are, you know, for some students, small group counseling, collaborating with your community providers. And then finally, your tier 3 should be just a few students, but that's really what the students that you're going to look at for wraparound support and referrals, and really making sure you have good partnerships with your community stakeholders and partners, and ensuring all needs of the students are met.
Great, thank you, Ashley. Does anyone else have any other thoughts or even specific resources that we might be able to recommend in terms of this kind of work, especially around mental health screening, maybe even examples of how we make connections or the kinds of organizations we might make connections to that are outside of the school or outside of the school building? Anybody? That's open to the whole panel.
Well, and one thing I'll just kind of, I'll go first and just kind of follow up, because you want to kind of, you know, one of the things I look at is the potential loss experienced by students who can't participate in activities that contributed to their development and sense of self. So like your athletes, your band students, your choir students, you know, that was the reason, you know, part of for a lot of kids, that's why they came to school, you know. And so one thing is you might want to partner with their community agency. You know, we're having some extracurricular sports, you know, that group, you know, travel or select sports or things like that that might be helpful, and bringing a sense of community.
Great. I think both Amanda and Molly also had something to add. Amanda, what, you want to go first?
I'll just jump in quickly. And I agree with everything Ashley says. I think it's a great comprehensive approach to start looking at this, especially if you have the capacity to do screening. In the absence, if we would certainly never recommend, if you don't have the resources in place to provide those interventions, that you would do something on a more informal scale. So even making sure, again, as I mentioned previously, that, you know, we're physically getting in touch with those families we haven't heard from to see what their needs might be. But also what could be in some cases when you can't screen, what might trump that even is just doing some resource mapping. What do we already have in our community? What does our school already do for families? And making sure that we're not just automatically looking, okay, now we're thinking post-COVID, this is all of the things we need to make sure we address, when really a lot of schools and systems have been doing a lot of these types of intervention and services previously. So we want to make sure that the right minds are around the table to make sure that we're already tapping into the assets that are available to us.
Great, thank you. Molly, did you have something you want to add?
Yeah, I would just piggyback on that statement as well, that looking at your internal resources and what you have available, and then in terms of those partnerships and those opportunities to call your, you know, to get in touch with your community mental health organizations, to get in touch with your federally qualified health centers, which are, you know, have the ability to do holistic healthcare for your communities. We can definitely get you in touch with whom those are in your state and your networks. Making sure you're reaching out to your hospital systems. And I would say internally, your school nurses are so key to information. Oftentimes they, you know, kids will go to the school nurses even before they go to the counselors if they do have a school nurse. And so, you know, ensuring that you are reaching out to them in terms of who are those kids that are kind of frequently coming to the nurse's office or coming to the counselor's office as of your last year's data or before school was canceled in March. And, you know, going through those, because that will kind of help prioritize what are those kids that are already labeled at high risk. They have to keep track of that data per most state guidelines in terms of who is visiting and who has those high risk health related issues, both mental health and physical health. So just ensure you're communicating with those individuals and reaching out to your healthcare stakeholders. We have a lot of stakeholders in our communities that are willing to help, and then I've been reviewing re-entry plans that the states and their education departments have been developing, and they've been creating their own re-entry plans of how they help support students and schools and staff, and so they can fit in with some of these conversations. So making sure you're reaching out to them now and frequently and communicating with them of what your plans are and how potentially how they can help meet some of these overwhelming needs that are going to be coming back.
Great. Go ahead, Amanda. And then Ken. Okay, Ken, go ahead. Amanda bowed out on us.
I just want to underscore that point, right? I think that what we have to remember is that expressing emotions is not something that everybody can do. And some people are actually given shame in expressing emotions. And for those kids especially, the body gives us a way out, right? And that's why I have always said that school nurses are our front line folks. And what's really important is that teachers and parents not poo-poo the little things that we never should have been poo-pooing, but especially now, the kid who has a tummy ache, the kid who has a headache, don't say like, just put your head down, see how you feel in 5 minutes. Those could be the only signals kids are sending that they have emotional distress, and the school nurses should be incredibly well equipped to pick that up. So I just want to underscore that point, that it's the great catchment area, especially for those kids who don't use their words. And the kids who are most deserving of focused attention often don't use their words.
Awesome. Thank you so much. I'm not going to ask you guys to answer this right now, but Ashley and Amanda, if you can do us a favor, one of our questions in the Q&A dialog box asks if you could recommend any specific screening tools. And I think when we talked earlier, you both had some ideas about specific tools they could use. If possible, if you could, type into the answer somewhere or the chat box some references or resources people could access, that would be really helpful. Really, really appreciate that. Another question from the Q&A is one that I certainly have, and that's around, a lot of this requires a shift in culture You know, I think a lot of us can agree what Ken said earlier with this idea that there's a lot that we know we should have been doing before. You know, they were obvious, there were secrets that were out in the open but not being addressed. And that providing these kind of services to kids in schools is going to require a culture shift. I mean, we know there is a lot of pressure, especially now, to do things like to address the COVID slump. I certainly know, I think, go back to my time in schools where I can absolutely tell you that people would say, we don't have time to address the emotional needs and support students in this way. We have too much that we need to gain. We have too much time to make up for academically, or if we tend to this, their academics will fall by the wayside. What would any of you say to people who are kind of confronting that challenge, which is how do we change the culture from schools should only be focused on educating students to that's impossible. You actually have to address the whole child in schools if you want to successfully educate them. How would you address that issue?
I'm going to start with something that I've been working on a reentry subcommittee on, and that's social emotional learning and well-being for students and staff. And our position is that this is the time for a cultural shift, and that this goes back to the heart of learning and why we are, or you are educators in the first place. And what we do is that over time, that has gotten away and it's been very curriculum based. And it's always been, we've got to teach for this test. And we discussed, you know, we need to take a step back and go back to the heart of teaching, and that social emotional learning is good teaching. It helps the students. I'm going to talk about how it helps the staff, social emotional wellness, and how that really translates down into social emotional learning for the student when the staff can take a step back and do that for themselves as well. So I really believe that the culture shift does start from the administration. It starts from the top down. The principals are the CEOs of their schools, and they have that power and authority to instill that with their teachers and start it now. Say it's time.
Great. Any other thoughts about how to facilitate a culture change in schools that further legitimizes the kind of things that we're talking about today?
I think Ashley talked about the buy-in piece at first. So I think that's important to ensure that the whole school's coming from this as a united front. I don't think it has to be standalone in terms of implementing some of the social emotional standards, although it certainly can be. You can have standalone lessons that are specific to mindset and growth and resiliency. However, especially in terms of abbreviated academic instruction, it should be embedded into the core academic curriculum. So a good partnership with teachers, making sure that even adding simple questions about how did that make you feel, or let's talk about empathy, or how do you think the main character felt. These are all things that can be worked into an English language arts lesson, or having some journaling exercises after it. I think we don't want to just do that in isolation. We want to be intentional with how we do that. And we certainly want to be able to follow up with students that might be showing that they need follow-up, but having discussions about this. How does this look when we're face-to-face? Because we'll be 3 or 6 feet apart. We'll be wearing masks. We won't be able to recognize facial expression, or maybe our body language is different. How does this look in a virtual setting where we might be asynchronous and that kids are doing independent work, or if it's a synchronous setting where you might be able to split off into little groups, having discussions about it. I think when we're struggling because people are going to be focusing on math and in reading level progress, we will want to make sure that we are as intentional as possible in terms of embedding some of these other standards and social emotional skills, self-advocacy, how to ask for help when you're struggling with this new learning environment. All of these things promote healthy interpersonal skills, employability skills, all things that are just as important as the math and reading, addressing the math and reading slump as we return back to learning.
Yeah, I mean, I totally agree. Thank you so much. The idea that if you help someone grow into a full enough person that they can then do something with the academic learning that's happened is an important step. And so, I mean, I think schools really are designed to help students grow in their best, in the best case scenario. And so you did a great job of describing that kind of growth so that students are able then to make the most use of the skills they learn in school. There are a lot of really interesting questions related to students, but I feel like there's two issues we definitely want to address that we haven't addressed yet. One is to directly talk a little bit about people who aren't students. I mean, school community, of course, students are our mission, but we're a community that includes faculty, staff members, school nurses, people who work in cafeterias, people who work in maintenance, bus drivers. You know, we have so many people who are a part of that school community. And I think one thing we should also ask is what specifically we be doing to help the adults caring for students cope with the impact on their work and lives. Becky, we know you've been doing a lot of work related to this. Would you mind sharing some best practices with us or thoughts about this?
Thanks, Mike. Yeah. So I think the first thing we have to do is just acknowledge, as I read some of the things through the chat, that none of the scenarios that we have are good. They all have level of risk and they all have collateral damage. So whether it's getting sick from COVID or the mental health impact, you know, and I think it's important just to acknowledge that we're dealing with a situation that, I mean, if I may say so, kind of sucks on all levels, right? It's difficult in any scenario we're given. And in every school district across the country is handling it different. I know just for my sake, you know, we're 3 weeks out from school and we're still really not sure. And just that uncertainty alone brings a lot of stress and anxiety. And I think people are feeling that across the nation. So when we look at student staff and the faculty and all the people that work to bring that learning environment, we have to recognize that they're human. Our teachers, our nurses, our custodians, our wonderful food and nutrition services they provide. In our state alone, we have 67% of our students who are on free or reduced lunch. So we're providing a lot of social services to the kids, and it's a stress all around and not knowing how things are exactly going to go. So, you know, my thought first is we look at when things seem complicated out in the future, we need to dial back and look at what is in our immediate control, what we can control. And how do you approach wellness simply because everything seems so complicated right now, and the last thing you want to do is complicate your health. And I think we can all agree that basic health measures really do work. So for that individual teacher, that individual nurse, that individual administrator, dial back what's in your control and make sure you're looking at wellness on a simple level, daily activities of self-care that you can do. And it sounds very trite, but it's also very true that we do that. And that's for basic self-care. But one of the things I found in a very large district, we have 14,000 employees and 84,000 students. So it's a lot, are just from the administrator level, the HR human resource level, just making resources known to teachers. I know the EAP services are just critical. We have to reduce the stigma around the feeling and the need. People need to know it's okay to not feel okay. And it's a healthful thing to reach out and get help. We offer EAP services. Most school districts do. And I find a lot of employees either just doesn't register with them, that they have these free health services available to them, and they are virtual now and also underneath their plans. So sometimes it's just those basic things that are available for students or for staff that they need to utilize. EAP services, telehealth, and telehealth behavioral services so that they can get some of the services they need. And that's on the individual level. Then when you look at the school as a unit and the staff as a unit, you know, pre-COVID, I think what most of us did was kind of take for granted the stress and mental health relief we got from our community. You go into school, you get to commune with your other teachers, you have that connection and you have that relief. You're able to discuss, you know, things. And bringing that back around, that people need community and they need to have that relief. And so as we move forward in this unknown environment, not knowing if we're in person, if we're hybrid, if we're totally virtual, I think administrators in schools need to facilitate for the teachers time and flexibility and adaptability so that they can have a community circle with their peers, and so that they can vocalize what they're feeling in a safe environment, and they can get that feedback and they can get that camaraderie. Just that alone we take for granted as something that really can help our mental health, just knowing that we have peers and we can do that with them. So on that base level of school by school, we have to take that time and allow that time for our teachers to have that community circle. And we have to keep reminding them and communicating to them of those outside medical resources, health resources that they have, so that they can reach out and know that it's okay. My little thing is okay to not feel okay. It's a good thing to get that help through the EAP services. When we talk about that total population, like we have the transportation, maintenance, and organizations, we have a multi-generational workforce. Younger people feel a little bit more comfortable reaching out to an EAP or mental health. Older people, not so much. There's still that stigma, and maybe it's not confidential, and so it's really important from a communication standpoint that administrators and supervisors are communicating with their employees, saying it's confidential, it's private, and it's okay, to reach out for that help that you need. And just to keep basic self-care practices. And someone had put in there, does running, I'm not a runner, when Dr. Ginsburg had the analogy of running and stress relief. Any movement, any exercise, anything that brings you joy, it can be a walk, it can be some yoga, it can be some stretching, any physical activity, and it doesn't have to be hard, right? Because some people do shy away from that. Anything like that can help your health. It doesn't have to be, it's that expectation of what you think it is and what it really can be could be different.
Great. Thank you so much, Becky. I appreciate that, especially the comment around administrators creating and validating time and space for these things. I mean, everything you said was great, but clearly in the rush of all the extra expectations that will be stacked upon everyone in the school community, instead of just telling people more of what to do, creating time, space for them to actually do it is something that schools can certainly, a contribution they can make. When the idea for us having this virtual conference started, it was before the tragedy of George Floyd's death. When we originally started putting this together, clearly there was a lot of emphasis on COVID because that was the pressing historical challenge of our day. In the time since then, we clearly have another pressing historical challenge that I think for many people present the same level of concern. They're the same level of being affected, and I would even suggest for people who don't feel that, we would like them to feel more of it, or we would like to feel more of it, to understand it better, to address these issues as well. Although this wasn't what we originally put the conference together for, I think it would be super out of our values as an organization not to create some space to ask you guys as experts on students and coping, what guidance you might have for those of us who are helping students affected by events related to racial and social justice, and honestly by the health disparities that are attached to COVID as well, that are based in racial and social injustice. Could any of you speak? I know, Ken, you spoke this a little bit before. If you'd like to speak to it more, great, or if anyone else has any other thoughts they'd like to share, we definitely want to hear them.
I think first what you have to recognize is that your schools have likely had issues regarding racism well before COVID and for a long time. And so I think what you've got to really do during this opportunity is when you plan on returning to schools, what changes are you going to make to move before just recognizing what we've done to really becoming anti-racist? And what are some of those policies? And when we look at grouping children, you know, for example, that's, you know, just in public education in itself has been a partner of that systemic racism that's been around for a long, long, long time. And so I think staff and everybody that returns to school has to recognize that and realize we're coming back in a different world than when we left in March, you know, and to be mindful that not only COVID, but the murder of George Floyd, the murder of Breonna Taylor has impacted students more so. You know, I'm married to a high school teacher, history teacher and coach. And, you know, we've done, you know, he's constantly showing videos about this, but allowing students to have an opportunity to speak, because I think what we tend to fail as educators is not hearing from our students directly and getting their buy-in. I think we instead want to tell what our experiences are or what our holes we might see in our anti-racist education, but we need to involve our students in this plan, because they're the future. This is the generation that's going to lead us and hopefully lead us to a better place.
Thank you, Ken.
Yeah, I have several hours of things that I would love to say on this. But what I will do is I will give you another link, which I don't have the capability of knowing how to do now, but to a free chapter from Reaching Teens, an open access chapter led by some of the leaders, all from communities of color, leaders in the world of adolescent medicine and social work around talking about racism with students and creating a common language. But I'd also like to underscore the words that Ashley used. She talked about being anti-racist, and she also talked about listening to students. I think it's imperative that we listen to students in a way that doesn't make our children of color be responsible for teaching the rest of us about their experience. That can be profoundly painful. So we need to have a couple of different tracks where we are supportive to our children of color who are not in an awakening, who don't see this as the cool new social movement, but who see this as the air they breathe that has affected them and their ancestors for hundreds of years. And that we give them the level of social and emotional support that understands the trauma they've gone through and the questions they have right now about whether they are really gaining allies, whether they are really gaining people who will change and be continued allies, or whether the time will change. And when our schools show real commitment, to quote Ashley, to be anti-racist, meaning not putting up posters like this is something we're doing for the month, but that we are really looking at the systems and structures. For example, no offense, but who decided that school resources should be related to parental income? Who decided that? I mean, come on. There are some real systems and structures that perpetuate inequities. And if we're going to look hard and show our kids that we're doing that, then I think we're going to give them the sense of hope, that aspiration that they're going to build a better world. And the last thing that I really want to underscore is that there are political forces in this country that are making this feel like a zero-sum game. Like, if we honor true diversity, meaning listen to the wisdom and experiences of people among us and share decision-making, some of us need to lose. I think we need to be emphatic as youth advocates that make all kids understand that we all gain when we become allies. We all gain with an anti-racist agenda. We live in a better, fairer, juster world with less discrepancies, less, so that's an important thing, is that for those children who are awakening, that they're not awakening to a problem for which they're going to need to sacrifice, but they're awakening to a potential of building a better world for everyone by focusing on the inequities that have always existed. So we've got to really think about the framing. Literally, that's a soapbox of mine. I'm sorry.
No, please don't apologize. I think this is the soapbox that a lot of us can relate to, and that certainly people need to hear. You know, I think kind of connected to this as we wrap up, we just have a couple minutes left. I see a comment that said it was a great soapbox. I couldn't agree more. You know, one of the things, and maybe you guys could help me speak to this, one of the things I worry about a little bit, or maybe a criticism of resilience sometimes, is this idea that, you know, I love the way, Ken, that you framed it earlier. This is something that adults and kids do together. I think too often we think of resilience as something that kids have to do. And instead what we do is, or some people do, is describe how kids can be better victims in a terrible environment adults have created for them, instead of keeping adults on the hook for us being the ones to say, you know what, it's our responsibility to create the best possible environment for young people to grow up in. And I think this definitely relates really strongly to both COVID and certainly to issues around racial injustice. You know, one of my concerns right now is that people are so overwhelmed by COVID that you know, the issues of racial injustice we've been facing since the inception of this country. And so I worry a little bit about, you know, people's, you know, adults feeling like they can't handle all these things at once. And I think that's something that we can't afford not to do. I think we have to address both things. We have to, as adults, kind of step up and create environments in which kids and other members of the school community can be strong, resilient, and grow past not only the current challenges related to COVID, but these historic injustices that have, you know, been woven throughout the history of our country. Ken, do you have any closing thoughts about that concept, about what adults, you know, our responsibility as adults to make this world happen? I think you're on mute.
I do not have better closing comments than what you just said, Mike. I think that the point is made that it's about us and about modeling. What I attempted to do, and this is the first time I've ever attempted to do this because I'm not really technologically gifted, is that I gave you two links to racism. They are both free. One is from Reaching Teens, one is from Building Resilience. We had them both ready to go because we've been caring about this for a long time, and they can be widely disseminated to everybody. But your point is exactly right. It's about modeling, Mike, right? Kids feel safe when we make them feel safe. Kids are open to new ideas when we are open to new ideas. So, yay you, I love what you said. And I love what the panelists said.
I was going to say yay for the panel. I really appreciate all of you so much. I want to thank each one of you for the time that you've invested, the expertise that you've offered us. I also want to make a shameless plug. In the next session, Dr. Bettina Love will also be talking more specifically about issues related to diversity, equity, inclusion, racial and social justice. So if you would like to hear more about that, there will be more discussion about that in the next session. And again, thanks so much to everybody. I think at this point, Jeannie and Casey, it's back to you guys.
Awesome. Thank you so much, Mike, for leading this great group and for taking us down this wonderful path. I think that I really like where we ended and the nice flow into the next section.